Good evening, everyone. I'm Alyssa Jordan. I'm an assistant psychiatrist at GenPsych. Imagine coming home and seeing your loved one's lifeless body on the floor and being filled with regret and guilt that you couldn't be there during their time of need. Well, in order to prevent that from you or a person from experiencing that, there are facilities like our facility in New Jersey called GenPsych, which offers inpatient to outpatient programs for people who are developing or having mental disorders to have treatment by participating in cognitive therapy, dialectical behavior therapy, or just being prescribed the right dosage of medication and knowing that you have support and people behind you to back you up. We have worked with psychologists, therapists, and doctors around the world to help make sure this facility is what people want and what people need who have developed or had mental disorders and ways to benefit them too. Our mental clinic has 4 different programs, which our 4 programs are for mental disorders. We are eventually expanding, but right now we're just focusing on those 4, which is depression, anxiety, eating disorder, and body dysmorphia. We offer affordable rates for people inpatient and outpatient. We have found rates that correspond and are covered by insurances. We offer transportation, food, and other services, including therapy sessions, which are 7 days a week, psychiatry sessions, which are 3 days a week, and tutoring service, which are every day, which helps you learn while you're not in school. You may say an inpatient program. Well, every patient that comes to our program is first given an assessment, which helps us monitor how severe, mild, or low their disorder is, and based on their negative coping skills, ways or what programs to actually put them in. This also helps psychologists, doctors, and psychiatrists have more information on you to be able to know like which route they want to put you in or which coping skills they want you to learn. By this way, everybody in our program is put into an inpatient program, which, yes, is from 7 a.m. to 3:30. So that person will be missing out on school. But anyway, this program allows you basically to learn about a lot about your disorder, how to cope with it, and ways to move forward. Back to our tutoring services. Since students will be missing out on school, we were able to communicate with most of the students' schools and teachers and principals and able to work out a way to receive assignments, quizzes, and tests and exams and homework to actually be able to still keep you on track. We got 6 or 7 tutors to come to our facility and to take you and other people that are in our program and teach you, either help you prepare for quizzes, teach you a lesson, or just help you in general study for a test coming up. We also have worked with your teachers who are extremely understanding of the process and have worked with some accommodations to give you to help make this experience more easier and less stressful. This is accommodations that you may have as additional time for finished assignments, allow open books for your tests and quizzes since you're not there to actually receive the lesson, and additional material to be handed or given to you, such as watching YouTube videos or more reading material to actually understand the concept. We also have worked with some teachers, and some teachers agree to actually video record their class, so you're able to actually see the lesson without actually being there. But to move on to the further main part and important part is the types of therapy sessions that we offer. Based on your assessment, determines on whether we place you in cognitive behavior therapy, group therapy, or just dialectical behavior therapy. According to World Health Organization in 2018, there are a few types of therapy programs that have been found highly efficient and are rated highly efficiently, which are psychotherapy, medical therapy, and just cognitive behavior therapy, which all works on alleviating your symptoms, changing the way you think, or adding a balance to your the chemicals in your brain and trying to have a chemical effect on your neurotransmitters and your brain itself. Dialectical therapy is a session that we offer here, where it's a minimum of 6 to 7 people, and we help you by teaching you different coping skills and strategies such as the 5 senses, to mindful activities where you look out the window and you write down 6 sounds that you hear or 6 things that you see that are moving. We also offer cognitive therapy, which is also a session that teaches the same thing, except we work on more of the underlying causes. So what triggers you, what are the bad coping habits, and what are ways you can turn those bad coping habits into positive coping habits. While in the afternoon, everybody attends a large group setting and we all have group therapy, which group therapy can be fun because we can either do music therapy, art therapy, dancing therapy, or a type of form of talk therapy. According to Mental Health America, combining medications and therapy tends to have a higher effect in improving a patient's condition rather than just attending regular therapy. We also have 6 psychiatrists that will come on site in the afternoon, and we'll have one-on-one with each person on Monday, Wednesday, and Fridays. This time is where the patient will disclose any problems with the medication, any self-harming experience, any challenges that they're facing or stressful events, or any triggers that are occurring more frequently, just any of that. Stephan and al. Research has concluded in 2015 that shows that there's a connection between therapy and patients that are suffering with a disorder. People that received cognitive therapy showed a significant decrease in suicidal rates and symptoms for their disorders such as depression. Lastly, in conclusion, this is why you should actually come to our facility, is because we offer affordable rates. We offer transportation within 15 miles away from our facility. We offer different types of physical therapy that we think could help benefit you based on your assessment. And we basically monitor your behavior and based on that allow you to progress as an individual and learn coping skills to be able to grow. Life is hard as long as we live it. At least we have the right people behind us or surrounding us that makes it worthwhile or worth living, because we realize that we're not alone. I want you to think about how much your life impacts the people you love. Pretty much a lot, right? If you are struggling to deal with your mental disorder, then consider visiting our facility, which is located in Bridgewater, New Jersey, where we can offer good coping skills, a way for you to cope with your mental disorder, and ways for you to not let your disorder define you or affect your life. I want you to take 15 to 20 minutes to take a psychological mental health assessment provided on Psychology Today. These results are not as accurate, but at least they make you aware of some of the symptoms that person have will be developing that, and it allow you to actually analyze it based on you. Based on your results, you can visit our facility if they're high and consider looking into our program and actually get diagnosed by our psychiatrist on site. Well, thank you so much, and I hope you get the help that you need if you need it.